Hello, everyone. Welcome back to the Medical Teaching Podcast for both teachers and learners. And today I'm going to be talking about something that I really believe in and feel is important. And it may seem obvious to many of you who are listening, but if it's not, then great, awesome. Then I hope this is helpful to you. One of the things that I really feel strongly about is that one of the greatest gifts that we can give to our learners is to talk our thoughts out loud when we're seeing our patients, when we are thinking things through, when we are doing our medical decision making. I think it's so important for us to talk out loud, to share our thoughts out loud, to share our decision trees with our learners and to help them know what questions to ask. And so a lot of times, really, I'll bet you that most of us as teachers actually probably do that to some degree or another anyways. But I think that the real key is to not just do it, but to also point out to our learners, hey, when I'm talking, when I'm saying these questions, or when I'm talking out loud, or when I'm thinking out loud, or when I'm saying these things, these are the questions that you should be asking in your own mind. And so really there's kind of several things that I think are the things that I would uh, want to communicate to our residents. So number one is I would want to just think out loud whenever we're talking through getting a history from our patient, thinking through, what are the things that we ask? After we ask, what is it that brings you in today? Then the next thing after they're done talking, is we start going into asking a lot of clarifying questions. So let your learner know what is going into your thought process for those clarifying questions. Why are you asking these particular clarifying questions rather than other clarifying questions? For me, the approach that I have taught my learners is to, after you ask, so what brings you in today, and then letting them talk, then the thing that I teach my learners to say is to say, okay, so is there anything more to the story? Is there anything more to the story? Is there anything more to the story? And letting our patients have a chance to say anything else and everything else that they want to just push to us and let us know. And then after that, I tell my learners to ask the OPQRST, right? The onset, the pain and palliation, the quality, radiation, severity, timing questions. And that's, of course, we all learned that in medical school. But then the next questions that I then have my residents ask are centered around forming a differential diagnosis and then asking questions to rule each differential diagnosis in or out. So that's a method. I'll be talking more about that in another episode. But in this particular, I think the point I'm trying to make is that we can tell our learners, or we can, if our learners are shadowing us, or if they're not with us for a long time, or if they don't learn our method of taking a history, then just sharing with them, okay, so I am asking the OPQRST questions. And then, okay, now I'm thinking of a differential diagnosis. I'm thinking of, for chest pain, I'm thinking of acute coronary syndrome. Okay, so I'm going to ask the patient, is the pain substernal? Is it right here? Is it right under your sternum? Is the pain worse with activity? Is the pain improved with nitro, right? These kind of questions. And then the next differential diagnosis that I'm thinking of is aortic dissection. Okay, is it ripping, tearing chest pain? Does it radiate through to the back? Do you have very elevated blood pressures at home? And then the next thing in the differential, tension pneumothorax, for instance. Have you had any recent recent traumas or injuries to the chest area? Any recent surgeries? Any recent procedures like a central line or anything like that? And so on and so forth. And talking out loud. So I think that that's one thing that's very valuable, is to share with our learners what we're thinking, how we are, why we're asking the questions we're asking, which leads, of course, to the next thing. Is a lot of times our learners are, when what they're learning from us is learning what questions to ask, right? When we come out of medical school, we've read a lot of books, we've learned a lot of things, we've taken a lot of tests, but sometimes it's hard to know what is the correct question to ask in this particular clinical scenario, right? And that's part of the clinical experience, right? Is learning what questions to ask. And so a lot of times as clinicians, as experienced clinicians, a lot of times these are the questions that they just naturally come to us, right? From our experience, we know to ask X and Y and Z, but our learners do not. And so it's doing them a huge service to share with them, okay, so we have encountered this situation, so the questions that you should have in your mind should include X and Y and Z. Because if you just do it and you don't tell the residents to pay it, or the learner to pay attention to that, to the questions that you're asking, and pay attention to why you're asking them, then they may miss it. And so it's important to point out, hey, these are the questions that I'm asking. These are the important questions you need to be asking when you encounter a similar clinical scenario. So I think another thing is that, there are certain problems or medical topics that come up, and, for instance, seizures or atrial fibrillation with rapid ventricular response, or an acute CHF exacerbation, or even a code blue, right? There's an algorithm, there's a specific decision tree that takes place, right? So let's just take AFib with RVR, for example. What is the first point of the decision tree? The first point of the decision tree is you've got to decide, are they hemodynamically stable or are they unstable, right? So then, talking out loud with your learners. Okay, so what does hemodynamically unstable entail? What does hemodynamically stable entail? And then, so that's the first decision tree in atrial fib with rapid ventricular response. Then once you've established that they're unstable, then you have to direct cardioversion. If they are in fact hemodynamically stable, then you move to the next decision tree, right? Is to decide, okay, what's the patient's blood pressure? Is the blood pressure high or normal, or is it low, right? If it's low, then we might want to do something more like amiodarone or digoxin, whereas if it's high or high end of normal or even normal, we could do something more along the lines of IV metoprolol or IV cardizem, and so on and so forth, right? And also having the decision tree, do they have Wolff Parkinson White or not, right? Checking for delta waves. So the point is that in many cases, we have that decision tree in our mind that we work through automatically in our mind. Our learners can benefit from that. And if we don't call specific attention to that decision tree, if we don't tell them, hey, this is the decision tree I'm using, these are the decisions I'm making, and sometimes drawing it out for them or writing it out for them, that can make a huge difference as well. And finally, for the decisions, when you have to make a judgment call, if you have to make a if there's a situation where you have to decide between, okay, am I going to give ciprofloxacin, or am I going to give Levaquin, or am I going to give cefepime, for this particular situation, and why, right? Spell out why. Talk about, okay, well, so, all these are broad spectrum, but I might have more appropriate coverage with one antibiotic than the other, and also there's the risks of side effects with cefepime, higher risk for neurotoxicity and seizures, or whatever the case may be, right? So, and talking it through out loud with our learners. Now, I think that though talking those things out loud, talking out what we're thinking, what questions that we're thinking of, what are the right questions to ask in the situation, how we're thinking through the situation and the decision trees, and how we're making those specific judgment calls. I think that these are the things that can really be a huge benefit and gift to our learners. Now, I can already imagine some of the objections that might be given to me would be, hey, Dr. Lee, Lawrence, I don't have time for that. I don't have time to talk through everything. If I talk through all my decision points, if I talk through everything that I was thinking in my mind, then it would take forever. It would take all day, and I would never get through my work day, and my learners would be overloaded and overburdened with too much information. Absolutely. So, right? We're talking, it's got to be tailored for the learner, and it's got to be tailored for what we ourselves can handle with our workflows as well, right? So it really comes down to being able to to decide, okay, what one or two patient encounters or what one or two clinical situations would be beneficial for our learners to kind of have a chance to hear us talk through our thought processes and go through them with our learners. And I think that if we do that, even with one or two patient encounters per day, then our learners will have received a tremendously great gift. Or even if it's not at the bedside, then talking it through afterwards. I mean, it doesn't have to be in real time. It can be after the patient has left, or you've left the patient's room, and you're sitting down and you say, okay, so what did you observe? And then how would you have handled this decision? How would you have handled that situation? What did you observe that I did? How would you have done it differently? How would you have done it the same? What things are you going to learn from this? How are you going to copy it for next time? These are the kind of questions that I think going through afterwards for one or maybe two cases per day can be exceedingly helpful for our learners and can help elevate our teaching of our learners. And I've found that my learners really appreciate it when we have those kind of discussions. So I would love your thoughts and your feedback, and talk to you with the next episode.